So we're going to take this from the pre-brief team, continuing on from the last video for the tutorial. We're now at the point where we're pre-briefing our team of medical team, giving them this information that you read here so they can further make their decisions. You can scroll up and down. Here is our dashboard. So right now it's not started yet officially. This is single tablet mode right now, but in multi-tablet mode, they will have an area in their top corner where they can adjust the oxygen, turning on their oxygen flow, how many liters, and how much oxygen they want to start with. For this scenario, it's actually a staff assist, so this should all be set up before they even arrive. You can set up whatever as an instructor, as how many liters you want the oxygen flow to be at and what kind of oxygen you want it at. But each scenario will be different, and how you want to lay it up is all up to you. So now everybody's ready, and we're going to start the timer. At this point, you can read, single tablet mode, you will have to read to the participants, but if you have two monitors or dual tablet mode where they're paired up, you don't have to read to them because the overall assessment will show up on their monitor. So they can read it as a team and decide how the scenario should unfold. So going over the buttons, the top right corner you have a pause, looks like a sound. That is to activate the sound of the heartbeat or mute the sound of the heartbeat. Currently with the beta client, this is not activated yet, but hopefully we'll have that rolling out by the time this releases. Stethoscope will reveal the chest assessment and will give you the heart rate. That heart rate is only active without the monitor for 10 seconds because if I hit it again, it's changed. So that's all based on your team skill level. Down here under it is the monitor button. When you see the participants connect the patient to the monitor, you can hit that and that will display your current heart rate and saturation level. In this situation, because we took a long time before we did any actions, the patient is decompensating and is in a very bad state. So we'll go over the different bottom buttons now. Mr. SOPA, that's a multi-stage skill level. Start positive pressure ventilation, start chest compressions, transilluminated chest. The top level are close to all respiratory related for the neonatal portion. The bottom level is more for procedures and medications. So we'll go over start positive pressure ventilations. This will help the baby out, and you can hit the stethoscope button and that will activate the chest assessment. So when you hit the stethoscope button, you're only doing that if you see the team place the stethoscope on the mannequin. This will prompt them. So there's no more the team looking at you, asking you what the heart rate is. You have to actually follow along and do what they're doing. This will provide them with more information. Mr. SOPA, if you click on it, you'll notice here it's a multi-stage emergency procedure. If you notice that there is no chest wall movement, if the computer program defaults to no chest movement and they decide to do Mr. SOPA, all you do is follow along with what they're doing. If they're adjusting the mask and repositioning the airway, you will click the buttons. When you hit the PPV and reassess chest movement, the one that's in green right now, that reassesses and will run another program, whether you have chest wall movement or not. So if you do not have chest wall movement and they want to go to the next stage of Mr. SOPA, you tap it again. This will remember they already did the first two, and it will continue on. So you can continue all the way down here, and perform Mr. SOPA is also where you will see place LMA. So this is right now the only place you're going to see place LMA at this point. And if you want to go right to it, place LMA, you can jump right down there, which should take you to laryngeal mass procedure. Proceed. And if you notice here, it tells us as instructors, LMA is inserted, and the patient is not doing a great job, but you see them put the stethoscope on and you continue on. So everything else in here is pretty self-explanatory. You follow along with what the team is doing. You can pause at any time. At this point, when you're in the pause mode, you can undo situations, you can reset the scenario, you can end the scenario and debrief at any time. Even though you chose specific objectives for your scenario, it does not mean that you have to continue until you complete the objectives. Sometimes the team is shown that they are adequate and they're going down all the proper algorithms, and they don't complete maybe a saline bolus. That's okay. You can just end the scenario and it just won't show that that objective was met. If you want to undo, notice how I undid that last action. Now they did not put this LMA in. So you can resume and you can go from there. So notice the bottom, the medications. You don't have anything for a saline bolus. That's because if you have no umbilical line, you can't put a saline bolus in. So we'll place the umbilical line. And you don't need to check off every box. You're checking off the boxes only when you see them perform the action. Now notice how that place umbilical line is changed to administer saline bolus. We're going to administer a saline bolus. This is going to ask us, was the correct dose given? Yes, the correct dose was given. Now notice how it now says stop saline bolus. When you see the team say the saline bolus is in, or if you see them disconnect the saline from the umbilical line, that indicates the saline bolus is done. You can hit stop saline bolus. This is taking a timer to make sure that they are actually infusing it over the 5 to 10 minutes as required or as recommended by the AAP. Epinephrine is the same way. When you hit administer epinephrine, now you'll be given the option for endotracheal tube and umbilical vein. This is purposely allowing endotracheal tube because there are times where intubation is unsuccessful, and when you give the medication down the endotracheal tube that is placed wrong, you will get a response accurate to if you were really going to give epinephrine down the endotracheal tube that may be in the esophagus, which is not very effective. So we'll do that. It's going to ask me, was the correct dose given? Yes, the correct dose for that was given. And if you notice here, the patient's decompensating and did not do well. Chest compressions. So if you notice here, chest compressions will muddy up your line and dampen the waveform. This will stay this way until you have completed your chest compression round, or if you hit stethoscope button, or you transilluminate the chest. Because realistically, if you see the team transilluminate the chest, they can't also be giving chest compressions at the same time. So this has been a brief tutorial on the dashboard to Steps Insitu. And as always, if you have any more questions, please reach out to me, jason@stepsinsitu.com, or support@stepsinsitu.com. And I'll try to get back to you as soon as possible. Thank you very much, and talk to you guys later.